This video demonstrates a myomectomy performed via single-port laparoscopy. In this procedure, relaxation of abdominal muscles is induced through deep neuromuscular blockade via rocuronium. This treatment allows the surgeon to work in a larger operating space, which is critical for a laparoscopic procedure being done via one small incision in the belly button. Comparisons of measurements taken before and after induction of the blockade demonstrate how muscle relaxation allows the surgeon more space to work and better access to internal organs. The use of deep neuromuscular blockade to enlarge intra-abdominal volume during surgery reduces the risk of post-operative complications often associated with laparoscopic procedures.
Today we started with a case, a 35-year-old woman with two fibroids, one pedunculated fibroid, big, large, it was 450 grams, and a smaller one on the anterior side of the uterus. And she wanted to get pregnant, and she suffered from pain and bleeding from these fibroids, and we performed a laparoscopic myomectomy. It went nicely, and we did it with a low pressure system and deep block. There is some indication in the literature that if you're working on lower pressure, the patient will have less pain afterwards.
Begin by anesthetizing the patient using standard hospital procedures. The patient is administered propofol and remifentanil until loss of consciousness.